Hello, everyone. I'm Carolyn Coleman. Welcome to Gentry's Journey. This is Men's Health Month, and we have a subject matter expert, Mr. Isaiah Sankey. Now, he's going to tell you all about himself. I want to welcome you all again to Gentry's Journey. And women, help our men out, by explaining some things to them. You'll probably be more comfortable after this presentation. And men, take it seriously. What this is coming from another man, and he can explain himself and teach you about Men's Health Month and how to properly care for yourself. Isaiah, are you ready?
Yes, good evening to each of you, and thank you, Ms. Coleman, for the privilege of being on with the audience this evening. I am Isaiah Sankey. I am a certified family nurse practitioner. I graduated from Troy University School of Nursing. You may hear my dog in the background. I'm not sure why he decided to bark when I start talking. But in any event, it's a pleasure to be with you all. As I was saying, I graduated from Troy University School of Nursing. I have a Master of Science in Nursing, and I'm a certified family nurse practitioner. I also have the privilege of serving here in Montgomery as the president of the Metro Montgomery branch of the NAACP. And I've been in that role for about 6 months now. And I decided, and I think this is important, each president coming into the role has an opportunity to decide what his or her platform is going to be. And so having a background in healthcare, I have chose as my platform, at least for the next 2 years during my tenure as president of the Metro Montgomery branch of the NAACP, is building a legacy of health, building a legacy of health here in Montgomery County. And part of that entails trying to identify means or approaches or to interventions, rather, regarding how do we address the shortage of healthcare providers. And so I'm excited that through my leadership and the support of my branch members, we've been able to create what we call the Legacy of Health program, whereby we have identified students in high school and we've created an environment, a very intensive, interactive environment to expose them to the field of healthcare. And so we partner with Baptist and Faulkner School of Health Sciences, Cara Star Behavior Health, Troy University School of Nursing, and Troy University, where we're holding our class downtown at the Rosa Parks Museum with these young people. And we've created a dynamic environment to expose them to the field of healthcare. So they might consider, after they have gotten the exposure, they might consider choosing a career in healthcare and thereby helping to reduce some of the, at least address, provided the shortage of healthcare providers. So I just wanted to get that out there because I'm excited about that. And so I'm also a father, married for over 40 years, have two grown sons, five grandchildren, and just love the field of healthcare. I also have the privilege of serving as the county commissioner. I represent County Commission District 4 here in Montgomery County, and I'm into my third term in that capacity. And so healthcare, government policies, decision making, all of that is interrelated. So I'm just excited to be here with you all to talk about Men Health Month. June is Men Health Month all over this country. And there's so much that we can talk about as it relates to men health. And as Ms. Coleman said, we need the women. We need you all. We need the sisters and the wives, the grandmamas and the aunties to really engage with us, because sometimes we're reluctant to talk about our health. We're reluctant to seek the medical attention that we need, and consequently we suffer unnecessarily from some treatable, some curable diseases. If we would only just begin to open up and talk about these things, and have the family members get involved. Don't be afraid to talk to your wife about things that's related to your health and so forth. And I'll just go ahead and share this. This may sound a little personal, but I'm glad when my wife is observing me or listening to me in the bathroom. She say, "Your urine stream doesn't sound as strong as it used to sound hitting the water." And so, even though it may be a little embarrassing, embarrassing or being a bit intimidating, you say, okay, she noticed that urine stream is getting a little weak. So I'm glad that she's paying attention to me. And so those type of things, if you witness that, or if you notice something about your partner, your spouse, your father, your uncle, or whatever it is, that you may be observing, don't just, I wonder what's wrong with him. Begin to engage in a conversation so that we might uh, be more cognizant and aware that you all are looking, and perhaps we might be more inclined to seek the medical attention that we really need. So, having said that, if you all are ready, I have a slide presentation. And of course, interrupt me anytime you get ready. And if I hear you, I will certainly stop talking and try to listen to comments, your concerns, or ask any answer rather, or respond to any question that you may have. And so it's June. June is Men Health Month. And so we say, well, that being the case, then what are the next steps? If it's Men Health Month, then what are we doing? We going out to party? We going to celebrate? Or what are we really going to do? What are the next steps? Since we all know now that's June rather, it's Men Health Month, then where do we go from here? Okay. And so we know that black men's state of health oftentimes is health repair versus health maintenance. Now, what do we mean about that? What we mean about that, instead of going in on a regular basis, health promotion, disease prevention. That's what we learn as nurse practitioners. You got to actually take care of yourself before you get into trouble with your health. And so a lot of times we're into health repair. What can we say? Well, now we're short of breath. We hadn't been going in to get our checkups and so forth, and now we're short of breath, and we're wondering what in the world is going on. If it's heart failure, if it's some respiratory ailment due to breathing pollutants in the air, maybe it's an environment where we work at, and we have not been getting our annual chest x-rays and maybe pulmonary function studies. And so now we can't breathe. So now we're in a state of health repair. We got to do something right away versus health maintenance. And we have been getting those annual checks up and those checkups, getting the colonoscopy, getting the PSAs and so forth. Taking care of those things. If we work in an environment, that might have some toxins and so forth that we're breathing every day. Are we attending to that on a regular basis so that we can catch these things before they get out of hand? Or are we always in a state of health repair where we're just trying to fix stuff after it's gotten out of hand? And so oftentimes we find ourselves in a state of health repair versus health maintenance as black men. And so we have got to do better. So hopefully by the end of this discussion, we would have been inspired to do a little bit better. And as I said, now what are we doing with June being Men Health Month? And I think Juneteenth coming up, that's the so-called emancipation for African Americans, Juneteenth. We didn't find out until 2 years after the Emancipation Proclamation, the slaves in Texas found out that they were free. When General Granger rode in on his horse to announce, that we had been freed some 2 years after the Emancipation Proclamation. So what do we do about that? Are we just going to get in the park and have a party, on Juneteenth and celebrate and so forth? Or are we going to mix some education with the celebration? And that's what we need to do. We need to be familiar, not just with Juneteenth overall, but what does it mean to be a citizen? What does the Constitution say about rights and privileges and so forth that we enjoy? And how do we begin to talk about some of the health issues during that time? That would be a good time to talk about men health issues, particularly African American men. While we're celebrating, we need to also be educating, the population on how to better care for ourselves. And hopefully, you all are in agreement with that. Don't just celebrate, educate.
That's true.
And that's what I'm hoping to inspire. Okay. The leading causes of all death in men of all races, males of all races, the leading cause of death in all men, heart disease. 24.3% of the deaths in men are related to heart disease. Heart disease is the number one killer amongst men of all races. Number two is cancer. And probably the leading cause in men is prostate cancer. And certainly the fatality rate is greater in black men than white men. In unintentional injuries, you might be talking about gunshot wounds or motor vehicle accidents. Uh, 7.4% of the cause of death in men of all races, unintentional injuries. And you know, with this increased gun violence, that can certainly present. Well, it has presented. It's a national issue, actually, in a very urgent matter. And then, of course, we have chronic lower respiratory diseases. Could come from smoking, could come from pollutants in the air that we breathe. Maybe occupational exposure could contribute to some of the chronic lower respiratory diseases that we suffer from. And that's the fourth leading cause of death in men of all races. Stroke is number five. You know the devastating effects of a stroke if you've ever cared for individuals with a stroke. You know, they can be light, moderate, or it can be very severe, where they are completely paralyzed and they're completely dependent upon others to care for them. And then there's Alzheimer's disease. Uh, it seems that is somewhat that's on the rise, I would say. And you know how devastating Alzheimer's disease can be, a progressive, relentless deterioration of one's mental capacity in terms of your ability to reason and so forth. And that certainly that short-term memory is impacted more so than the long-term memory. If you ever seen anybody with Alzheimer's disease, it can be very, very devastating, and certainly very, very hard on the family members, your loved one, someone you've been married to for 40, 50 years. Now they don't even recognize your face, you know, and so it can be very, very devastating and very trying for the family members, for those with Alzheimer's disease. And suicide. It's on the rise amongst African Americans for a number of reasons, but that's the eighth leading cause of death in men of all races. And then we got influenza and pneumonia. And of course, some of this may have come about because of the COVID pandemic. Uh, and so at number nine, currently, we have influenza and pneumonia as the ninth leading cause of death in men of all races. And then you got chronic liver disease and cirrhosis. And of course, we know about alcoholism and how that can certainly impact the health of the function of the liver. So there you have it. Heart disease, cancer, unintentional injuries, chronic lower respiratory disease, stroke, diabetes, Alzheimer's disease, suicide, influenza, and pneumonia. And rounding out number 10 is chronic liver disease and cirrhosis, leading the 10 leading causes of death in men of all races. And now, black men, a little bit different here, a little bit different. So now the 10 leading causes of death in black men, and you see heart disease is still up there at number one. And then we have cancer, prostate cancer being number one in that category. Uh, Unintentional injuries. Again, we're talking about gunshot wounds, motor vehicle accident, riding without your seatbelts, weapons everywhere in today's society, being used indiscriminately, you know, sad, a national emergency, gunshot wounds, homicide. Again, some of that comes from, of course, gunshot wounds, and just not being able to control your anger, not, being able to de-escalate situations at the right time. Stroke, number five, in men, African American men. Diabetes, probably not a surprise, coming in at number six. Black men, we're talking about chronic lower respiratory disease, number seven. Kidney disease, number eight. Septicemia, just infection from a number of causes. Sometimes you may not get the medical attention in time. You got, staph aureus or some of those other diseases. And so you got, something wrong with your leg, is swollen up, painful red. You ignore it, maybe you got bit by maybe a brown recluse or something happened. Maybe you're diabetic and you just didn't take care of that little sore before it got, infected. And now, bacteria is running all through your body. Septicemia, ninth in terms of the cause of death in black men. And then hypertension. Probably not a surprise. Probably surprised that it ranked number 10. And it, could be a little higher, but, maybe stroke and hypertension go hand in hand. And so high blood pressure. High blood pressure is still the silent killer that we really, really need to be more cognizant of and do something about it. And I think part of that includes getting your annual checkups and so forth and participating in those health screenings at work and in the community. And then, of course, following up. Not just It's just not enough just to participate, but of course, you got to follow up. Okay. Uh, and so let's talk a little bit about health equity. Okay, health equity. And equity, I'm not talking about equality now. So in equality, you're talking about all things being equal. But in equity, I might need a little bit more than you need because I might be living in a less affluent zip code. We don't have the necessary things, that we need. There's a lot of gunshots. The infrastructure is not being properly maintained. Maybe there's pollution in the air. There's gunshots all night long. And so you live in a more affluent neighborhood, perhaps. And so maybe you need a little bit less when it comes to the resources because you're already up there, where you don't have to worry about breathing polluted air, gunshot wounds, the stress. You're not living next door to abandoned buildings and so forth. And so when it comes to the distributing the resources from local government, and I say that as a county commission, maybe my neighborhood needs a little bit more than your neighborhood needs because of equity, not equality. I've been left out. So maybe now it's time to make it up to me, whether you believe in diversity, equity, inclusion or not. And regardless of what the state of Alabama says or the federal government says, it's important to address equity, particularly when it comes to health. So health equity is when everyone has the opportunity to be as healthy as possible. And I don't see why anyone would want to argue with that. I just can't see why anyone would want to argue with that. Everyone ought to have the opportunity to be as healthy as possible. And it is the attainment of the highest level of health for all people. Now, some people may not believe in that, that all of us we all have the opportunity to be as healthy as possible. You know, we all have the opportunity to have nutritious food, vegetables and fruits and other things available at the market where we shop. It ought to be that. It ought not to be where you have to get your groceries from the service station or the convenience store. That's health equity, having those things available to us. And so I don't see why anyone would want to argue with that. Health equity is something all of us ought to be advocating for our fellow citizens. Because when all of us are healthy, less money has to be spent on emergency care. And so why would anyone argue with that? But in any event, politics creeps in and, we have to address those issues as well. Health disparities. And there are health disparities particularly amongst people of color, on the lowest socioeconomic scale, those historically disadvantaged and underserved communities. I can speak for myself. I lived in some of those communities. And so health disparities do exist. Health disparities are differences in health outcomes and their causes among a group of people. So we have differences in outcomes because sometimes we're not getting the proper care we need. Sometimes we can't afford to go to the doctor. We don't have adequate insurance. You know, Sometimes it's the choice between medicine and food. All of those things, those socioeconomic conditions impact health outcomes, right? And they impact certain groups more than they do others. And so we need to be talking about health disparities. It shouldn't be a conversation that we shy away from. I don't care who's in the room. You know, we ought to be able to address health disparities. And not only that, but we ought to have a plan of action in terms of what we do. What are we going to do? And all of us have a role to play as citizens. Yeah. Calling those elected officials and making sure that they are accountable when it comes to allocation of resources, when it comes to boarded up abandoned homes. Why are we leaving our communities in those conditions when we already got an ordinance on the books that can address those issues? But the citizens have to be engaged. We have a responsibility to be engaged and to demand more of the resources, a more equitable distribution of the resources. Okay, so much for the politics and the policy and the decision making. And let me just say this, decisions that are made in this country, in your state, in your city, in your county, somebody decides what's going to happen. Who's going to get the paved streets? Are the houses going to remain boarded up and abandoned in your neighborhood? What quality of education are our children going to have? Whether the grocery stores, where they're going to be located, where are they going to put the industry that pollutes, where they're going to put the industry that pollutes the environment. Okay, so what's going on with that? So we all have a role to play, and we all it's our civic duty to be engaged in policy and decision making, because everything that happens in this country, except for a tornado or a hurricane, act of God, somebody decides what is going to happen, and it may not always be in your best interest. So we must stay engaged. Okay. Black men in the United States suffer worse health than any other racial group in America, with the lowest life expectancy and the highest death rate from specific causes compared to both men and women of other racial and ethnic groups. And that's from the Center for Disease Control and Prevention. That data comes from them. We suffer worse health outcomes than any other racial group in America. Make you feel like, well, I'll leave that alone. But in any event, it causes some concern. It causes some concern. Make you feel like you're not too far from slavery. Yep, with those type of statistics. Yeah, being reported by the Center for Disease Control. So we got a lot of work to do. Okay, a lot of work to do. Key determinants of health. Religiosity. Now, so sometimes we get so religious, right? We we think, well, well, we know that God is able to heal. He's able to do exceedingly abundantly above all that we can actually think, based upon the power of faith that worketh within us. And your faith has to be strong. I'm a man of faith. But if you have been nausea, vomiting for 3 or 4 days, you got to pray about it, but then you got to go see your doctor. You need to ask the Lord to guide you to a healthcare provider that's competent enough to take care of you and that's going to listen to your concern. We can be too religious sometimes, saying the Lord going to heal us. I know he's going to heal me. And he will, by sending you to a good doctor. That's how you act, sometimes. Sometimes we speak our spirituality. We're saying, that, hey, I just, I'm just going to trust. I'm just going to trust and believe, when you should be up putting on your clothes to try to go see that doctor after you get through reading your Bible and praying. Yeah. And of course, stress. We all know how stress can impact you. I mean, you have headaches and all kind of stuff, mental, emotional, well-being being impacted just by stress. Your spouse worrying you, your children worrying you, your boss worrying you. Sometimes you just worry. You don't know why you worry. Stress can certainly impact the health. One of the key determinants of health is stress. Incarceration. A lot of our African American men are incarcerated. I mean, you visit some of these federal prisons, these large prisons, you got six, seven, 800 black men all behind bars. And you say all the talent pool is locked up. Incarceration is, when you're living in them crowded conditions, you're spreading all type of illnesses and so forth. And not only that, but you're probably not getting the quality. You're not getting the quality of care that you need. Just getting basic. Racism and segregation. Well, we don't have to talk too much about that. We know racism can certainly lead to poor health outcomes. Segregation, where you're not in the affluent community where all the health clinics are. You could walk to a health clinic in some of the communities, and the other communities you live in. First of all, you got to have a car. You don't have adequate transportation. Public transportation don't get you to your doctor's office because your doctor way on the other side of town. So, the segregation plays a big role in terms of our access to health care. We got to catch the bus, go maybe get a transfer and catch another bus to get to a good doctor. Right. And then smoking, now some of this stuff, lifestyle modifications, well, no, stress, racism, maybe we can't control that, at least not to the degree that it needs to be. But smoking, we can control that. Diet, we can control that. So watch what you eat. More fresh fruits and vegetables. Stay away from a lot of fried, greasy food that's have a high fat content. And I don't know why you got to smoke. I don't understand that anyway. But it's addictive. Nicotine is a drug, so you need to try to find some way to get off it if you can, if you're smoking. And sometimes we just don't have the insurance. That's a key determinant. I remember when I didn't have no insurance, Lord. My first child was born, and I'm without insurance, got a big old hospital bill, Lord. And I think they had to take me to court or something. But in any event, you can do what you got to do. Education. Sometimes you just don't know. Your lack of education, the lower education level you have, the worse your health outcomes are going to be. And that just stands to reason. If you're not reading about your health, you're not you're conscientious when it comes to health, and nobody's in your house is talking about health. They're talking about everything but health because sometimes it's just a low education level. And then poverty. Poverty just wreak havoc on, if you're just struggling every day, you ain't got time to really be thinking about your health. You're trying to figure out how you're going to live, or even if you want to live for that matter. And so, key determinants of health, that religiosity, spirituality, stress, incarceration, racism, and segregation, smoking, but you can do something about that, and your diet, you can do something about that too. But based upon your income, sometimes, you're just choosing the wrong stuff because it's cheap, and you're trying to stretch that dollar. So I can understand that. And then lack of insurance, and then your educational level sometimes impacts uh, your health outcome. And then, of course, poverty is always a factor when it comes to determinants of health. Okay. Heart disease. These are some, things we need to be dealing with. We will all say heart disease was the leading cause of health, and then we can have different type of heart disease, congenital heart disease. You're born with that. And pediatric heart disease might come about, as in the childhood, and that can be devastating. Might find out that you have all these different things. God forbid, transposition of the great vessels. And you might have a leaky valve, or maybe a foramen ovale where the hole didn't close up. So you got blood communicating between the lungs and the heart before it gets, before it picks up the oxygen from the lungs. And so all those things can be very devastating in terms of your health. And then hypertension heart disease, of course, as we said, it has this is one of the 10 leading causes of death in men. Then you got arrhythmias, tachycardia, atrial fibrillation. Atrial fibrillation is irregular rhythm of the atrium of the heart, the top portion of the heart, and it can cause blood clots. Then you got coronary or artery disease. You maybe experience some chest pain where the arteries around the heart. You see those arteries on the heart. They feed the heart muscle, and they can become blocked. And then you start having chest pain. They have to go in and do coronary artery bypass grafting, where they are trying to get past the blockage in the heart. Because if you don't have adequate blood flow to the heart, you're gonna know it one day when you start having the chest pain, that crushing pressure on your chest. And then, of course, congestive heart failure, where the heart is not pumping efficiently, and the blood is backing up into the lungs. And that is certainly something. Heart disease, leading cause of death, and those are different type of heart disease, heart ailments that we sometimes have to contend with. Okay, and so what are we gonna do? We're gonna try to modify our lifestyle. I told you, diet is we can control that to a certain degree. I realize, like I say, sometimes you got low income, you just got to make that dollar stretch as far as it can. So you're gonna eat the cheap food, and sometimes that can be a problem. But we can buy some beans. We grew up on beans. I didn't know that beans were a source of protein when I was little. All I know, that's all we had to eat. And thank God that my mama cooked them beans, because then it gave me some muscle, helped develop my muscles. Yeah, instead of feeding me sugar. So praise God for that. And so diet, exercise, moderate alcohol consumption, ladies and gentlemen. Hmm? Maybe 1 ounce a day if you're gonna drink it all. Don't take one and you just have to have another one. So leave that alcohol alone, really, for the most part. Weight reduction. Okay. Uh, you can get 5 to 20 millimeters of mercury, decreasing your blood pressure with each 10 kilograms of weight loss. Okay. And I believe 2.2 pounds is 1 kilogram. And so you lose about, maybe 5 pounds or so. But if you lose about 10% of your current body weight, you can increase your overall body function by 20 to 30%. So look at this: a low sodium diet, a diet that's high in potassium, which you get bananas, oranges, avocados, tomatoes, are rich in potassium. Okay. And of course, you want to be careful about increased potassium in your diet if you have kidney disease. And of course, you have to discuss that with your health care provider. Okay. So just take a good look at those lifestyle modifications. A lot of time we bring the trouble on ourselves. We want to eat, we want to smoke, we want to drink, we don't want to get exercise, we want to sit in the house watching that 20, I don't know, you got 50-inch screen television on the wall, flat screen, you got with all kind of stuff, next flick, and you watching next flick, this flick, that flick. And so you're living. You feel like you earned the right to sit up there and eat that bowl of ice cream late at night. But don't get too carried away with your wealth and your success. Get out of that house and get you some exercise. Please, people, get you some exercise. Yeah, because that money, it may not be able to save you. You need to put some of that excessive drinking and smoking and eating that red meat. Reward yourself every now and then. Get you a steak, maybe every 6 months if you need it. But be careful about what you eat. And please get you some exercise. Take your dog for a walk. Your dog want to go for a walk. He don't want to just sit there and look at you all day. Take the dog for a walk. Both of y'all can get some exercise. You'll feel better. Your dog gonna feel better. Okay? Maybe you should have left that dog where he was if you don't want to exercise. Now, I'm not talking about any of you all. I guess I'm talking to myself. So please forgive me. Don't get mad with me. Don't get mad with him. I got a dog. I take him for a walk as often as I can. He loves it too. He jumps up in the morning. Know he going for a walk. Yeah, he just acts so bad. Just get too excited. Look like he had learned something by now. He's just not disciplined. But I do take him for a walk and I enjoy it myself. Okay. Stroke prevention. All right. These are modifiable risk factors. You can do something about this. You can take your blood pressure medication. You can try to get out of that air pollution, but it's everywhere. It's everywhere, and so you have to kind of get involved with your government, your local government, the ADM, the Alabama Department of Environmental Management. If pollution is a problem in your neighborhood, get organized. Start to do something about it. Really. You'll be surprised the impact you can have if you start speaking up about the conditions of your neighborhood, the air you breathe, the noise pollution, all those things. You have to have a plan of action as a citizen. It's your right, your duty, your responsibility. You need to begin to ask yourself, what does it mean to be a citizen? What does it mean to be a citizen? And that means you would get involved. And if you're leaving the place a little bit better than you found it, then you may be on your way to being a good citizen. Okay, cigarette smoking. You can control that. Diabetes, you can take your medicine and watch your diet. The high fat in your blood, dyslipidemia and so forth, that causes problems, heart disease and so forth. These are the bad lipids. Okay, atrial fibrillation can be controlled with medication. Sickle cell disease. Well, people are living longer by staying hydrated and managing the pain. Okay, uh, and of course the things that I'm listing here can cause stroke. Okay. And so you have to kind of modify these risk factors. All these things I'm talking about can lead to stroke. Um, Postmenopausal hormone therapy. Uh, okay, depression can, I guess, lead to stroke, and you want to prevent those. Diet and activity. Low sodium diet. Increase your potassium intake if you don't have kidney disease, and watch your weight. Watch your weight. Okay. The ideal body weight. You take your current well, I won't say ideal body weight, but I want to talk about hydration. That's what I really want to talk about. You need more water. And you take your current body weight and divide it by two, according to one of the doctors, Doctor's Coin, his 7 pillars of health. And he said that if you take your current body weight divided by two, that's the number of ounces of water you need a day. And a lot of times we just not drink enough water. Okay? And so please keep those things in mind. Secondary prevention. If you want to prevent stroke, the anti-aggregants, Plavix, Coumadin, anticoagulants, blood pressure lowering medication. Stop smoking. Get that cholesterol down. And sometimes you might need to, if you're going to the doctor and they doing the right thing, they might, they're auscultating your neck, putting that stethoscope on your neck, listen to that carotid artery. They might find out you got blockage of the artery, you're having headaches, you're dizzy. You're about to pass out all the time. It could be your carotid artery from all that fat you've eaten over the years and smoking and so forth. And so you may need to revascularization. They need to clean that plaque out of those main arteries leading up to your neck that carry blood supply to your brain. And of course, diet and exercise, all very important preventive measures. Things we can do. You're gonna feel better when you get outdoors and start exercising, I promise you. Yeah. Prostate cancer, men. The second most common cause in cancer worldwide. Second most common cancer in men worldwide. And the fifth most common cause of cancer death in men, that prostate. Get that PSA now. A PSA is not necessarily predictive of cancer, but you need to get that PSA screened. You need to be screened because you can have a normal PSA and still have cancer, and you can have a high PSA and not have cancer. And so talk with a good urologist. A lot of times, they just, well, I better be careful how I say that. They biopsy sometime may be necessary. But make sure you ask questions. It has to be the shared decision making. Don't just let the healthcare provider, tell you what you need to do. Talk to them. Read for yourself. Be engaged in the decision making when it comes to your healthcare provider. In the United States, prostate cancer is the most common cancer in men and the second most common cause of cancer death. Okay, so you want to catch it before it gets outside of the prostate. That's why you need to get them PSA done and get those screenings. MRI of the prostate, I think it's kind of somewhat diagnostic, the definitive diagnosis when it comes to prostate cancer. And get on up there. If you don't, not comfortable with your local urologist, I've seen Dr. Bivens up there in Birmingham, and matter of fact, he had a different opinion than my urologist in Montgomery. So I was grateful for a second opinion. So don't be scared to ask questions. Get you a second opinion. Because the doctors are human like we are. They have the background, in terms of this, medical decision making. But you need to be helping your doctor. Don't just, take his word. Uh, yeah, well, you can, but you know, just you need to be studying too. You need to read. Sometimes you need to know as much as the doctor knows. So you better start reading and educate yourself. Okay, all right. So much for that. Signs and symptoms of cancer, lower urinary tract symptoms. Because now BPH, a benign prostatic hypertrophy, that's just enlargement of the prostate gland. You get up at night, you're peeing 5, 6 times a night. Your scream is not as strong as it used to be. You may not be emptying your bladder. You got to go back. You think you're done, you just got to go back. Right after you've been on urinated. Then, of course, hematuria. If you got blood, if you see the blood in your urine, you know something wrong. Please don't ignore it. Please, 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 if you see blood in your urine, don't put it up, zip up your pants and say, "Who, Lord, I hope it go away." That's religiosity. Don't be doing that. Hematospermia, that's blood in your sperm. If you ejaculate and you see blood in your sperm, you better do something about it. Don't be trying to hide that. That's hard to hide, though. Ladies, that's going to be hard to hide. And I know y'all not going to let them hide that. Yeah. And that erectile dysfunction, well, sometime, ladies, after a period of time, it just we have a little challenges. We have a little challenge. Sometimes we need a little help, little medication, and sometimes we need just encouragement. So don't discourage us when that happens. Try to help us out. We already our manhood is being questioned. We already maybe feeling a little inadequate. So help us out, please. Don't take that as an opportunity to get back at it just because you're mad with us about something we did 15 years ago. Don't be talking about us like that now. And urinary retention, you just sometimes that can be a problem. You have to go to the hospital and get a catheter put in your bladder because you can't pee. That muscle just don't relax and you can't urinate, and that can be very painful, gentlemen. So, ladies, we need your help in these areas now. Don't this is a time to help us. Don't be trying to make us feel bad because we did something 15 years ago and now you want to pay us back when you should have just we said we had gotten over that. And so we gotten over it. Let's leave it alone. Now we need your help. Okay. All right. So, and these some symptoms of advanced prostate disease. Start losing weight. Well, now if you just start losing weight and you ain't had been to the doctor until you start losing weight, come on now, don't do that. Don't do please. Don't wait till it get that bad. You ain't got no appetite. You're anemic, bone pain, You might have a pathological fracture where your bone just cracked and you no
Mm,
reason at all. You walk and you step out of bed one morning, you hear a crack, femur fracture, the big bone in your hip, your neurological deficit, spinal cord depression. Now you're weak, your arms are weak, your legs are weak, you got numbness and tingling all the time. Now, of course, you can have some back problems too. Now, so some of these back problems can mimic some of these things I'm talking about. So don't just jump up and say, "Oh Lord, I got prostate cancer," when you know you got a lower back problem where your legs were numb and tingling all the time because of from a chronic, uh, disease of the spine or of the back, lumbar disease, or anywhere along the spinal column. I know I had surgery on my lower back, so my legs and stuff numb, tingling, my back hurt sometimes. And I said, Lord, how can I tell the difference between this old chronic injury and prostate cancer? And that's why you better go to the doctor and let him do your prostate exam. Man, I don't know why. I know we feel violated when we have to have the director exam, the digital director exam. But so and see, man, we got to talk more about our experience. When we experience these things, we really got to talk more about it. I was talking to one of my partners today. The AC man came to check my air condition, and we started talking, and he was sharing and so forth about how how he had radiation. Um, and he's fine now. He had his prostate removed and radiation, and he's fine. And then there's another gentleman who took the hormone therapy, I guess the Lupron injection, and it decreases your testosterone, which increases your libido. And so he said he hadn't had sex in 5 years because he's not aroused anymore because of the way his cancer was treated. And so you got to be careful about the choice. You need to be informed. So you got to read. So if you happen to have cancer, God forbid, then you need to know what choice of treatment is best for you. And so if you don't want your digital rectal exam, now this is not funny, but he says best to have the finger in your rectum than to have a tube when you land up in the morgue. And so I
mm.
thought that sounded pretty harsh, but it was true. We got to be frank. We got to be, just real about this. And men, let's talk to each other more about symptoms we're having. Okay. And so, well, here we are. Next steps. What do we do? What do we do? We need to be concerned about the environment we live in, what the condition of the housing, the quality of the air that we're breathing. We engage in decision making when it comes to local government. As I told you, everywhere in this country, whatever happens, somebody decides. Except, like I say, for a thunderstorm, a tornado, hurricane, somebody is deciding where the money is going to be spent and who's going to get what. And you all need to be involved in policy and decision making. And that's why you elect folks that you're supposed to be able to talk to. Okay, need to educate yourself on some of these diseases. Know what the symptoms are. Okay, take care of yourself. Take care of your health. Economics plays a large role in health outcomes. We already said that. So advocate for more money for your neighborhoods, more money for health services, more money for Medicaid expansion. You can't just give up, and don't you think the elected officials are going, they don't always have your best interest in mind. They just passed expanded immunity for law enforcement in Alabama, so now they can almost do whatever they want to do and get away with it. And for all the law enforcement people, I got friends in law enforcement, and it seems like that legislates for the bad actors. And why would you use expanded immunity to recruit law enforcement? You're saying that, I guess the message you're saying that we're not going to prosecute you even if you're wrong. But I don't want to get too far into the politics. We just need to be aware. We need to know what's going on. Okay. And so I've just enjoyed myself immensely. I've talked a lot, and hopefully I did not offend anyone. Hopefully, you all at least begin, if you didn't learn anything, at least you began to consider your own health and ladies, the role that you might play in helping your man, that significant person, that male in your life. Father Day is coming up. Maybe you ought to have a conversation with your husband or with your father, with your uncle about health care. How's your health, Pop? Forget about that tie. He's not going to wear it anyway. Don't buy him another tie. Sit down and talk to him about his health and see how you can be a blessing in that regard. And Juneteenth, don't forget, we're going to celebrate our, independence if we are independent, if we ever, if we consider ourselves free. But there's always a struggle. Always. As long as life goes on, there's going to be a struggle between wrong and right, and we're always going to be separating uh, the sheeps and the goats. We're going to always be putting the goats on the left and the sheep's on the right. And as long as life go on, there's always going to be choices between wrong and right. And so, having said that, ladies and gentlemen, I just want to thank you for your time, for your attention. And it's certainly been a pleasure to share this information with you. Hopefully, perhaps we might consider changing our behavior in terms of our diet, our exercises, lifestyle modifications, things we can control ourselves. And again, I want to thank Ms. Coleman for the privilege of being with you all this evening. And again, I want to say thank you so much and all the best to each of you.
Thank you, Isaiah. Thank you, Mr. Sankey. I really, really appreciate it. Not only did you give us a lot of tips and some tools, guidance, you reinforced what I was saying about, come on, ladies, let's get on board. Let's help our men out. But
Yes.
men, you need to be open to speak as well. His wife, Mr. Sankey's wife, was attentive because she could hear. Because when you've been with someone for a while, you know their habits. You know them. You know them better than anyone, and that's a good thing.
Hmm.
So she was attentive. He picked up on it, and he went to what? He went to see the doctor about it. So that's what we need to
Absolutely.
do. So that's advocating for your mate. That's advocating for yourself. We just need to be on one accord when it comes to this. Yes, there men and women can be stubborn when it comes to going to the doctor, uh, uh, to admit something just may be wrong. But we're
Hmm.
human. We're human. So we need to all be on up on our health, getting these health checks, staying alert, staying abreast, like he said, as he put it so eloquently and a little comically, that, religiosity, spirituality, all of that is wonderful and it's good and it is needed. But the faith without works is dead. So we need to be working on what we need to be working.
Amen. Amen.
So I have
Hallelujah.
truly enjoyed and appreciated him. I'm sure you all have. And like you say, now come on, ladies, whatever happened 15 years ago, we should be over that. Help me out. I thought I was going.
That's
Anyway, that was
right.
very comical to me, but that was real. That's real life. What he was speaking to us. And that's one thing I really like about him. He knows how to get his point across. Okay. So thank you so much, Mr. Sankey, for all that
Yes,
you have
man.
done. Um, Give us just a second and we're going to finish. I want to thank everyone for tuning in to Gentry's Journey. I have enjoyed having you. This man's health is serious and we need to get serious about it.